Okay, good morning, everyone. Welcome. My pleasure to share with you knowledge about infectious diseases and in particular the coronavirus SARS-CoV-2 that I'm going to take you through. I feel very privileged to be asked, and I hope I can do good work for you. So, as per the introduction, I started my journey in 1980 in South Wales, Cardiff, when I arrived as a little boy. And I trained in the Welsh National School of Medicine. And thereafter, I did general practice. Not satisfied with being a GP in a lovely place, Brecon and Abergavenny, I decided to think about the miners' lungs that I used to see a lot of. And I felt troubled by seeing all these miners' lungs, people with lungs that were in a very bad state. So I went and did respiratory medicine at the Royal Gwent Hospital. So having now done primary care and secondary care, suddenly I thought, why stop there? And I did a third career, which was public health medicine. And then the fourth career, I went and became a consultant in communicable disease control. So I have a lot of experience, over 20 years in infectious disease control. I am the blue sky thinker. We look at the horizon to look at emerging infections, emerging disasters, emerging problems, and then look for and plan for solutions to these situations that may come our way. So I'm very much a behind the scenes guy. I often say to my friends and colleagues that if you see me in a suit and tie in a hospital or in a restaurant or in some building where you're not really expecting to see me, it means there's trouble here. And I have come to sort out an outbreak in that building. That's the giveaway. So let's do the journey. I've done a lot of work on Ebola screening. SARS in 2000, 2003 when it emerged. MERS we still have issues with, and E. coli's and the Campylobacters, the Salmonellas, the Legionellas, anything infectious, I've done a lot of it. So what I hope to cover this morning with yourselves is, it really is important that you understand the emergence of these viruses, the way they behave, the way they transmit, the way they infect, because then you can make your own empirical decisions. Because nothing is always bespoke in a guideline. But if you understand the fundamentals, then you can work out the solution for your particular area. So I'm going to cover it, even though you might sit there and say, what's the origin of viruses got to do with me? All of it enriches your knowledge and the picture, and then finally what you do about it. As operators out in the field, I think you need to know some fundamentals. So I will cover the origins, the epidemiology, in particular the time, the place, the persons who get ill, because if you know that, you know what to do about it. Of course, we will cover the pandemic and what it means and what are the implications for us, as well as the global picture of where are we at now and where are we going and what should we do 6 months, a year, 2 years, 5 years from today. In particular, my brief was to also address issues around transmission of infections in different environments and what control measures we can implement. So I have added a few slides particularly on transmission of infections in the environments where you all work in. And finally, we'll talk about the future issues. So let's make a good start now. And this is an important slide because I really want you to be fully conversant with the origin and the emergence of new viruses, because this is where you need to apply all your energies to. This one slide. The world has gone crazy and no one is talking about this slide. In the thousands of interviews I have given all over the world, This issue is not discussed. Give you an example of the, shall we say, 5,000 plus interviews. I have had an opportunity to talk about this issue about 4 or 5 times. This is the missing link here. What am I getting at? I'm getting at is this. There are viruses that live happily amongst other animals, reptiles, mammals, etc. They are none of our business. They don't harm us, we don't harm them. They live happily ever after. Mankind is messing around with nature. It's messing around for a quick, cheap access to protein, to food, to get a quick buck out of capturing wild animals or going into their habitat or going into their ecology, cutting down forests, cutting down areas where they live. And when you mess with nature, things happen. So here we have bats. They have their own viruses. They have nothing to do with us. Then you capture thousands and thousands of these bats and you put them into a stressed environment, an environment which is alien to bats. Bats are ancient beings. They were here before us. And then you bring the virus, the bats in close proximity to other mammals that they would not encounter in nature. In this case, I'll put down a pangolin. And then what happens is, so the virus has got an ability to reassort when it has a co-infection. So the pangolin has an infection A, and then it has an infection B from bats, and then you have the ability for a third virus to be created with bits and pieces of A and bits and pieces of virus B, and you make a new virus C. And when you make a new virus C, if that virus by chance can infect and cause disease and transmit amongst humans, you have given rise to the emergence of a new virus. And that is the way pandemic strains sometimes emerge. This is the same for influenza. We've had a practice run with SARS in 2002, 2003, and now we've got SARS-CoV-2 virus, COVID-19 disease. So that is the origin, and we must pay attention to this issue. Don't mess with nature. So now that the new virus has emerged, it is new, it is brand new. There is no existing immunity to it, therefore. It is transmissible. It is infectious to all human beings. It causes disease. It spreads fast. And the infections are sustained globally, all over the world. Therefore, COVID-19 is a pandemic. COVID-19 disease is a SARS-CoV-2 virus, is a pandemic strain. We know that now. I remember saying it was a pandemic well before the WHO could say it was a pandemic strain. People like myself can say these things a lot easier and faster than WHO can, because WHO has to go through so many committees, and therefore decision-making by WHO is by design slower. And we need to think about the way WHO operates, because it has come under quite a lot of criticism about it being slow and partisan and very too measured in its actions. But that's not the remit of this presentation today. So I really want you people to also have a concept of, where does all this stand in the big picture. So we have SARS, which emerged in 2002, 2003. It was quickly put down, and it had quite a high case fatality rate, about 10%. And then we have MERS, Middle East Respiratory Syndrome. That is still in existence, and the route for MERS is bats to camels, camels to humans. And you need to be watchful. You need to be watchful about the MERS virus, which is still there in the Middle East. Should it change its nature? Should it change from being not very infectious to being highly infectious and highly transmissible amongst humans? Remember, MERS has a high fatality rate. And then finally, we've got COVID-19 disease as well that I've already addressed. So look, as a comparator between COVID, SARS, and MERS and seasonal flu, for all the age groups, of the people who become ill with infection from a SARS-CoV-2 infection, COVID-19 disease, we expect about 3 to 4% to die for all age groups. Compare that with seasonal influenza, where people who become ill, 0.1% will die. So look, just from that statement there, we know that COVID-19 disease is a lot more dangerous. It is phenomenally more dangerous by many factors, 30, 40 times more dangerous than the seasonal influenza. Of course, we know that SARS, the case fatality rate was even higher, but we've managed to eliminate SARS from planet Earth by good public health measures taken early, key word, taken early. And also we had some luck on our side with SARS, which was that you became infectious when you were showing signs and symptoms of illness. With regards to COVID-19 disease, unfortunately, you are without symptoms, but infectious. And that is why control of COVID-19 disease is that much harder, because you are potentially infected and infectious without signs and symptoms. So coming on to the issue that you guys are all very interested in, the issue is that adequate or inadequate ventilation has an effect on the risk of transmission via infectious aerosols. And there has been a lot of talk that the coronavirus is droplet spread or contaminated surfaces. I have always felt, since March at least, that there is another route, especially in indoor settings, whereby the virus can also have an element of aerosol transmission. This has not been attended to as much in the media. We need to be aware that in indoor settings where there is small volume, i.e. smaller room, and lots of people, and there is a lot of droplets, there is a potential for aerosol transmission of coronavirus as well. So we have droplets laden with virus that are generated by talking, laughing, singing, coughing, sneezing, and they can give you a direct hit when you are close to somebody, or they can be aerosolized and transmit many meters away and infect other people. Of course, the aerosolization and its survivability depends on other factors like relative humidity, the temperature, and the volume and the contained volume in a room. So short-range transmission occurs over a distance of less than 1 to 2 meters when you are within talking distance of someone. And then long-range transmission occurs over greater distances with smaller droplets. And long-range transmission is of concern, especially as it can then go over several layers in a building, that way, laterally or vertically. Of course, these risks are much, much lower in an outdoor setting, because in an outdoor setting, there is a dilution factor. And with a dilution factor outdoors, the risk of acquiring an infection in outdoor green spaces is considerably reduced. The risks in outdoor settings is about close, prolonged proximity to an infectious person, rather than just taking a walk out in the countryside. And if you are taking a walk in the countryside and you pass people by, that is not an at-risk activity at all. It is being close and remaining close with people that you don't know. The more the people, the greater the risk. So an outdoor arena where you are sitting in close proximity over a long period of time is a different risk order compared to going for a long walk or going for a picnic in a park. One more item that I must address, although I haven't got a slide for that, is this, which is what about toilets? Well, the one thing I want to say about toilets is they're essential, they're necessary, they're important, we need them. And what can we do to mitigate? One thing you can immediately do to mitigate is remove those hot air hand dryers. They are not nice. They create a potential aerosol environment. So we need paper towels to wash and dry hands, and otherwise keep the area sanitized, more frequent washing, more frequent keeping it dry, clean, and highly ventilated. And then your outdoor toilets will be fine. So look, moving on to the containment strategies, what can we do? Well, where have we been? So we had a case, and then that case generated about 2.5 new cases. That's the R0 number on average. It's between 2 to 5. So the R0 for SARS-CoV-2 is about 2 to 5, depending on the environment. So this is where we've been. And where do we want to go? Well, we want in a lockdown situation, you reduce the mingling of people with each other. And as a result of reducing mingling, you reduce the R0 number. And what we really, really want to achieve is that the infectious case generates less than one infected person. And when your R0 drops below 1, you know you can eliminate it. Eliminating is going to be difficult. In fact, I think we're not going to succeed. So I don't think we will get to the third box that I have got in my slide here. I have a feeling that the SARS-CoV-2 virus is going to become an endemic virus on planet Earth, and we've got to have to learn to live with it. So just to enlighten you, what can we do when you have a control strategy that you want? Well, you can either, so the flattening of the curve, as you may hear that expression, is what you want is not to have too many cases in a short period of time. So you try and flatten the curve so that your number of cases don't go over the red dotted line, so that your health care capacity is not overwhelmed and that you can treat people with your healthcare capacity. Of course, if you are China or you're a rich nation, you can raise the red dotted line by building a new hospital. But ideally, what you want is not too many cases all in one time, and therefore you operate on the blue curve, not on the red arrow. So our control strategies, green arrow is what China can do, lock everybody up and have strict control. When the red curve is the UK, the USA, Brazil, where we were slow in controlling it, slow to implement lockdown, and very, hasty in lifting the lockdown. So you can get cases, a lot of people infected. And really the good people, the ones who've really succeeded well, are the South Koreans, who had a good, pretty good degree of control, and they've subdued the infection in their country. So I put this slide about Africa. We're almost on the home run now. So I've got a few more slides and then we are finished. So I put this slide about Africa to say this. It is important that the richer nations look after themselves and look after others, because if you don't, you have amplification. You have more and more people infected. More people infected equals it circulates around the globe. So as it circulates around the globe, you will keep on reintroducing the infection in your Western affluent nation. So it is in our own self-interest to look after our country, but to look also to the bigger picture, the global picture, and say we need to contain it elsewhere too. Help the WHO achieve this. This is important. I feel we've failed and we will have an endemic strain nonetheless. But the principles of control are you control it globally, not only in your country. So almost on the home run now, last 2 slides. The good news on the vaccine front is I think we will have a vaccine. I've changed my mind into being skeptical to saying I think the signals are we will get there with a vaccine. What we are not sure about is how long the immunity from a vaccine will be. That is a great unknown. So if it is only an immunity of 6 months duration, we will have to think of what use can we put this vaccine to, considering it only provides 6 months immunity. If, on the other hand, it provides long-term immunity, we're home and dry. But my concerns are, just because we are successful with making a vaccine doesn't mean we say sorted. We created this problem. That was my third slide about the pangolin and the bats. We must not create problems. So with respect to medicines, we've got very few, if any, that are really effective. We do not have medicines as yet which we can give to you to treat your coronavirus SARS-CoV-2 infection. Finally, so what have we got? We can do our social distancing, we must. We can do our wash the hands frequently. I always say timetable it. So timetable it every 2 hours, wash your hands from the wrist down and wash it thoroughly and dry it. And of course, maintain clean surfaces and ideally don't touch too many places. In indoor places, offices, supermarkets, such places, wear a mask. And the idea of wearing a mask is to reduce the volume of infected droplets coming from an infectious person in an indoor arena. So we suppress the number of viruses in circulation, hopefully reduce the case numbers. So the lessons from history are that prevention is better. We need to learn about what happened with swine flu, the plague, the smallpox, Ebola, SARS, COVID-19 disease. Prevention is much better than trying to fight the emergence of a new virus. We need to pay more attention on prevention. So in conclusion, really, is if we wish to go ahead, one is don't mess with nature, and two, prevention is better. Work on prevention. Finally, I would ask you, if you are looking for sources of updates and things, I try my best on Twitter. That's my Twitter handle, @Dr. Said. And if you also Google my name, Dr. Bharat Pankhania, YouTube, many of my media interviews have been put in one place so that it may be helpful to other people as a reference guide over the many months of the coronavirus pandemic that we are still in. That's me done. Thank you.